Well, the Indiana Heart Hospital just opened a center that focuses on genetic counseling. The goal is to prevent problems in high-risk patients. Barbara Lewis has more in the business of health. Barb.
Gary, thank you. Cardiovascular disease is the #1 killer of both men and women. Some of the conditions are inherited, so the goal of the new center is to offer genetic counseling so a patient can better understand and prevent cardiovascular problems. Joining me to talk about the new center and how it fits into communities' cardiovascular programs is Dr. Glenn Bingle, a medical geneticist with Community Health Network, and welcome.
Thanks, Barb. It's a pleasure to be here.
Let's talk a little bit about the overall goal of having a genetic counseling program for cardiovascular disease.
The goal is really to help our cardiologists in working with patients that probably have inherited their heart disease, whether it be a cardiomyopathy or sudden death syndrome, and to help them with getting a very detailed family history and then working with the patient and the family to find out if genetic testing is appropriate and who should have that testing. And then when the results come back, to actually sit down with the patients and help them understand what the risks involved and how we might prevent the disease from progressing.
Okay, what will it mean to the patient? What will the patient be asked to do?
The patient will give them an explanation of the basic mechanisms of inheritance. We'd give them an understanding of what it would be involved in a genetic test, that we would look for 70 or 80 genes that might cause this condition. And if we find them, then we can identify in their families who else would be at risk for this and be able to intervene very early once we have a confirmation that they are carrying that genetic mutation.
Okay, from a business side, how does offering genetic testing fit into communities' overall heart care program?
Well, the gene testing is very expensive. It costs on the average $3,000 to do a panel of genes, so we have to be sure that we have the appropriate candidate and that we have the appropriate insurance authorization and that we have the right individuals to go forward and explain the results of those tests once they get them back. Because understanding genetics can be complicated for a patient, and they're already in shock that they have heart disease to begin with, and then trying to alleviate their concerns about what we can actually do to help this condition.
All right, well, Dr. Glenn Bingle, thank you so much.
Thank you, Barb.
Well, if you'd like to know more about the new center, just go to InsideIndianaBusiness.com, your source for news, video, and business on demand.